Welcome to Module 3. This module focuses on identifying the problem that your curriculum will address. It also reviews the concept of completing a needs assessment for your curriculum, information that is relevant to assignment number 2 in this course. For the purposes of this course, a needs assessment is a systematic way to gather information about a problem or issue. Needs assessments are often completed in order to justify the development of a curriculum. The goal in health professions education is often to connect education or curricula to patient outcomes. And thus, in a needs assessment for a health professions education curriculum, it is important to clearly illustrate from a patient's perspective why health professionals need to be educated on a given topic. The following questions are important to address when completing a needs assessment for a curriculum. You may want to address some of these questions as you complete the needs assessment for your curriculum. As pointed out in the required reading for this module, it is important to identify and characterize the healthcare problem or problem in general that will be addressed by your curriculum. It is also important to understand how the problem is currently being addressed, and then compare this current approach to how it should ideally be addressed or approached as a way to justify the need for your new curriculum. As you complete the needs assessment, it is also important to consider who will be affected by your proposed curriculum and what effect it will have on, for example, clinical outcomes, learner outcomes, or society as a whole. I encourage you to consider the who and what questions as they are posted here as you complete your assignments for this course, especially in relationship to assignment number 2. Additional questions to consider in the needs assessment include the following. What is currently being done by the following individuals to address the given problem that your curriculum will address? What personal and environmental factors affect the problem that your curriculum will address? Are there things out of your control that you need to account for as you develop the curriculum? Lastly, what ideally should be done by the following individuals or stakeholders to address the problem that your curriculum is going to target? How might these individuals be involved in the delivery or planning stages of your curriculum? In order to complete a thorough needs assessment, you will want to review any documentation that is currently available that might help you justify the need for your proposed curriculum. You may also want to consult with experts in the field or collect new empirical information. However, it is very important to note that for the purposes of assignment number 2, you are only reviewing existing information. You are not collecting any new information or speaking with experts or anyone else to collect data. Simply, you are reviewing the existing information to justify the need for your curriculum. This information that you may be reviewing may include published studies, clinical practice guidelines, websites, reports from professional organizations, maybe curricula from other institutions that is similar to the curricula that you would like to propose, or published statistics from, for example, Statistics Canada to help quantify the problem that you're aiming to target with your proposed curriculum. There are 2 learning activities for this week. The details for both of these activities are posted in the learning activity for this module.